Addition to dehydration and diet, several medical and lifestyle factors can significantly increase the risk of developing kidney stones. One important factor is obesity. Excess body weight changes the way the body processes nutrients and chemicals. It can increase the levels of calcium, oxalate, and uric acid in the urine, all of which contribute to stone formation. Obesity is also linked to insulin resistance, which can make urine more acidic. Acidic urine creates a favorable environment for uric acid stones to develop. Therefore, maintaining a healthy weight is not only beneficial for heart health and blood sugar control, but also for preventing kidney stones. Certain medical conditions also raise the likelihood of stone formation. For example, recurrent urinary tract infections can lead to a specific type of stone called struvite stones. These stones form when bacteria in the urinary system produce substances that make the urine more alkaline. In alkaline urine, magnesium, ammonium, and phosphate can combine to form stones. Struvite stones can grow quickly and become quite large if not treated. They are more common in women because urinary tract infections are more frequent in females. Digestive diseases and surgeries can also play a role. Conditions such as chronic diarrhea, inflammatory bowel disease, or gastric bypass surgery can affect how the body absorbs calcium and water. When the intestines do not absorb nutrients properly, oxalate levels in the urine may rise. At the same time, dehydration from fluid loss increases urine concentration. This combination significantly raises the risk of calcium oxalate stones. People who have undergone certain types of weight loss surgery must be especially careful about hydration and dietary balance. Some medications may contribute to kidney stone formation as well. Certain diuretics, calcium-based antacids, and medications used to treat migraines or seizures can increase stone risk in susceptible individuals. This does not mean these medications should be avoided without medical advice, but it highlights the importance of discussing risks with a healthcare provider. In some cases, doctors may adjust dosages or recommend preventive measures if a patient has a history of stones. Another contributing factor is insufficient physical activity. A sedentary lifestyle can weaken bones over time, leading to the release of calcium into the bloodstream. Excess calcium may eventually pass into the urine, increasing the risk of stone formation. Regular movement and moderate exercise help maintain bone strength and improve overall metabolic balance. Even simple daily activities such as walking can contribute positively to kidney health. Symptoms of kidney stones vary depending on their size and location. Small stones may pass through the urinary tract without causing noticeable discomfort. However, when a stone becomes lodged in the ureter, symptoms can become severe. The most common symptom is intense pain in the lower back or side. This pain may spread to the abdomen or groin and often comes in sharp waves. Many patients describe it as one of the most painful experiences they have ever had. Other symptoms may include blood in the urine, cloudy or foul-smelling urine, frequent urination, burning during urination, nausea, and vomiting. If fever and chills occur, it may indicate an infection requiring immediate medical attention. Diagnosis typically involves imaging tests such as ultrasound or CT scans to locate the stone and determine its size. Urine tests help identify infection or excess minerals, while blood tests check kidney function and chemical levels. Understanding the type of stone is important because treatment and prevention strategies may differ depending on its composition. Treatment depends largely on the size of the stone. Small stones often pass naturally within a few days or weeks if the patient drinks plenty of water. Doctors may prescribe pain relievers and medications that relax the muscles of the ureter to help the stone pass more easily. For larger stones that cannot pass on their own, medical procedures may be necessary. One common method uses shock waves to break the stone into smaller pieces that can then pass through the urine. In more complicated cases, minimally invasive surgery may be required to remove the stone directly. Preventing recurrence is extremely important because individuals who develop one kidney stone are at higher risk of developing another. Drinking enough water to produce clear or light-colored urine is one of the most effective preventive measures. Reducing salt intake, limiting excessive animal protein, and balancing calcium consumption are also recommended. Contrary to common belief, completely avoiding calcium is not advisable, as too little dietary calcium can actually increase oxalate absorption and raise stone risk. The key is moderation and balance. By understanding the additional risk factors, symptoms, and treatment options associated with kidney stones, individuals can become more proactive about their kidney health. Awareness and consistent healthy habits are powerful tools in preventing this painful condition and maintaining long-term well-being. 2:33 p.m., 2/27/2026 Yusuf Sane. Understanding the different types of kidney stones is essential for proper prevention and long-term management. Although many people simply refer to them as kidney stones, they are not all the same. Their composition depends on the chemical imbalance occurring inside the body. The most common type is the calcium stone, particularly calcium oxalate. These stones form when calcium combines with oxalate in the urine. Oxalate is a natural substance found in many foods and is also produced by the liver. When urine becomes concentrated due to low fluid intake, calcium and oxalate are more likely to bind together and form crystals. Over time, these crystals grow into stones. Another type is calcium phosphate stones. These are less common but are often associated with certain metabolic conditions or urinary disorders that make the urine more alkaline. When urine is not in its normal balanced state, minerals can precipitate and solidify. People with certain kidney disorders may be more prone to this type of stone. Identifying the exact chemical makeup of a stone helps doctors design a targeted prevention plan. Uric acid stones develop in people who produce high levels of uric acid. Uric acid is a waste product formed when the body breaks down purines, substances found naturally in the body, and in certain foods such as red meat, organ meats, and shellfish. When urine is too acidic and lacks sufficient fluid, uric acid crystals can form easily. Unlike calcium stones, uric acid stones may sometimes be dissolved with medications that make the urine less acidic. This makes early diagnosis particularly important. Struvite stones are another category and are usually linked to urinary tract infections. Certain bacteria produce enzymes that change the chemical environment of urine, making it more alkaline. In this environment, magnesium, ammonium, and phosphate can combine to form large stones. These stones can grow quickly and may fill large portions of the kidney if not treated promptly. Because they are infection-related, preventing urinary tract infections plays a major role in avoiding struvite stones. Cystine stones are rare and occur in individuals with a genetic condition called cystinuria. In this disorder, the kidneys excrete excessive amounts of an amino acid called cysteine into the urine. When cysteine concentration becomes too high, it can crystallize and form stones. Although this condition is uncommon, it demonstrates how genetics can strongly influence kidney stone development. Beyond understanding stone types, it is important to recognize how daily habits influence recurrence. Many people who experience one kidney stone episode may face another within a few years if preventive steps are not taken. Hydration remains the most powerful protective measure. Drinking enough water to produce at least 2 to 2.5 liters of urine daily significantly reduces crystal formation. Clear or pale yellow urine is generally a good sign of adequate hydration. Dietary balance also requires careful attention. While reducing salt is beneficial, balancing calcium intake is equally important. Some people mistakenly believe that avoiding calcium completely will prevent stones. In reality, consuming moderate amounts of dietary calcium can actually help by binding oxalate in the intestines before it reaches the kidneys. This prevents excessive oxalate from entering the urine. However, excessive calcium supplements without medical supervision may increase risk, so professional guidance is important. Limiting excessive animal protein can also help, especially for those prone to uric acid stones. A diet rich in fruits and vegetables supports a healthier urinary environment by reducing acidity. Citrus fruits such as lemons and oranges contain natural citrate, which helps prevent crystals from sticking together. Increasing natural citrate intake through diet may provide additional protection. Lifestyle factors such as regular exercise, stress management, and consistent medical checkups further support kidney health. Individuals who have experienced kidney stones should follow up with their healthcare provider for urine and blood testing to monitor mineral levels. In some cases, doctors may prescribe medications that control calcium, uric acid, or citrate levels in the urine to prevent recurrence. Kidney stones may be painful, but they are often preventable. With awareness, balanced nutrition, proper hydration, and medical supervision when necessary, the risk can be significantly reduced. Taking responsibility for daily habits not only protects the kidneys but also improves overall health and quality of life. 2:36 p.m. 2/27/2026 Yusuf, Sain. In the final part of understanding kidney stones, it is essential to focus on long-term prevention, lifestyle awareness, and building habits that protect kidney health for life. While medical treatments can remove stones, true protection comes from daily discipline and informed choices. Kidney stones are often described as a warning sign from the body, a signal that something in hydration, diet, or metabolism needs adjustment. When people treat the root causes rather than just the symptoms, they greatly reduce the chance of recurrence. Hydration remains the foundation of prevention. Water helps dilute minerals and prevents them from sticking together. A practical goal for most adults is to drink enough fluids to produce about 2 to 3 liters of urine per day. This usually requires drinking at least 8 to 12 glasses of water daily, though needs vary depending on climate, physical activity, and body size. Individuals who sweat heavily due to exercise or hot weather must increase their fluid intake. Developing simple habits, such as carrying a water bottle, setting reminders, or drinking a glass of water before each meal, can make a major difference over time. Nutrition is equally important. A balanced diet supports stable mineral levels in the urine. Reducing excessive salt intake lowers calcium excretion in urine, decreasing the risk of calcium-based stones. Processed foods, fast food, and packaged snacks often contain high sodium levels, so reading nutrition labels can help individuals make healthier choices. At the same time, moderate calcium intake through natural food sources such as dairy products should be maintained unless otherwise advised by a healthcare professional. Completely eliminating calcium can actually increase stone risk because dietary calcium helps bind oxalate in the digestive tract. Protein intake should also be balanced. Excessive consumption of red meat and animal protein can increase uric acid production and make urine more acidic. Replacing some animal protein with plant-based options like beans and lentils may reduce risk. Increasing fruit and vegetable intake provides natural citrate, which helps prevent crystals from forming. Lemon water, for example, is often recommended because citrate can inhibit stone growth. Maintaining a healthy body weight further lowers risk. Obesity affects hormone balance and kidney function, increasing stone-forming substances in urine. Regular physical activity improves metabolism, strengthens bones, and stabilizes mineral balance. Even moderate exercise such as brisk walking for 30 minutes a day contributes to overall kidney protection. Consistency matters more than intensity. For individuals who have already experienced kidney stones, personalized medical guidance is critical. Doctors may recommend periodic imaging tests or laboratory analysis of urine composition. In some cases, medications are prescribed to control calcium levels, reduce uric acid, or increase urinary citrate. Following medical advice carefully reduces the likelihood of repeated painful episodes. It is also important to listen to early warning signs. Persistent back discomfort, changes in urination patterns, or visible blood in the urine should never be ignored. Early evaluation allows for timely intervention before complications develop. Preventing infection and addressing urinary tract issues promptly also protects the kidneys from additional stress. Beyond physical health, maintaining awareness and confidence is valuable. Many people who experience kidney stones feel anxious about recurrence. However, understanding the causes and actively taking preventive steps provides reassurance. Knowledge transforms fear into control. With proper hydration, balanced nutrition, regular activity, and medical follow-up when necessary, the risk of future stones can be dramatically reduced. In conclusion, kidney stones are not merely painful deposits. They are often the result of long-term imbalances in hydration, diet, and metabolism. While modern medicine offers effective treatments, prevention remains the most powerful strategy. By respecting the body's need for water, moderation, and healthy living, individuals can protect their kidneys and maintain overall well-being for years to come.